First, when talking about behavioral trauma symptoms, there's avoidance behavior. After experiencing trauma, young people often try to avoid situations that remind them of what they've been through. Over time, this avoidance can grow, leading them to steer clear of activities that their peers consider normal, further isolating them and limiting their experiences. Next, trauma can lead to a state of constant alertness, where the young person is always on edge, anticipating that something bad might happen. This heightened state of vigilance keeps their body tense and primed to react at the slightest trigger, often resulting in one of the classic stress responses: fighting back aggressively, fleeing from the situation, freezing and becoming unable to act, or fawning by trying to please or appease others to avoid conflict or danger. Sometimes, young people might begin to imitate behaviors related to their trauma. These maladaptive behaviors can vary widely and, in severe cases, may lead to substance abuse, self-harm, or even suicidal tendencies. Some young people might feel compelled to repeatedly talk about a traumatic event, sometimes even to strangers. This behavior is a way for them to process what happened, but it can be alarming to those around them, who may not know how to respond. Finally, trauma can sometimes lead to eating disorders. To cope with their emotions or regain control, some young people may develop disordered eating behaviors, like restrictive eating, binge eating, or self-induced vomiting. These behaviors might help them manage overwhelming feelings in the short term, but they can cause serious health problems if not addressed.